Your client's mental health is closely linked to their financial decision-making capacity and financial vulnerability. Financial stress and vulnerability takes a toll on the mind and can cause stress, panic, obsessive thoughts, depression, and other mood changes. Yet financial vulnerability is sometimes overlooked in mental health assessments and treatment. What if there were free tools to help you identify clients who are financially vulnerable so you can understand and address the financial issues impacting their mental well-being? The good news? There are. Since 2014, a set of easy-to-use and robust tools focused specifically on financial decision-making have been researched, designed, and extensively tested to help you assess the financial health of your older adult clients. So what are these tools? They are 3 distinct interviews designed to assess an older adult's decision-making abilities and help determine whether they are able to continue making independent, informed financial decisions and/or are at risk of being exploited. Additionally, the interviews allow you to have a better sense of your client's financial decision-making concerns and capacity, which can be a first clue of a cognitive deficit or decline. They also can act as a baseline to help you know when an older adult's abilities are changing and they may need additional support. The tools include an array of resources as next steps. These can help prevent exploitation in at-risk clients by referring them to financial coaching, training, or counseling. If exploitation has already occurred, programs are also available to help file charges and protect and recover funds. A score of low or no risk can help relieve a client's mental stress. At the heart of this effort is Dr. Peter Lichtenberg's desire to empower older adults with the information they need to advocate for themselves and be provided with trusted resources for support. The interviews come out of the work done by Dr. Lichtenberg. He is a clinical psychologist by training and the director of the Institute of Gerontology at Wayne State University in Detroit, Michigan, one of the nation's preeminent public research institutions in an urban setting. Dr. Lichtenberg, a distinguished university service professor of psychology, has also used his expertise to testify in dozens of cases involving financial capacity and financial exploitation. The tools are the result of many years of extensive research, published in peer-reviewed journals. They're backed by empirical data and tested in the real world by mental health, healthcare, financial, and other professionals. Their use by professional organizations reinforces their credibility. These tools have been used with a large, diverse population of older adults and are well received, appreciated, and have identified and protected many at-risk individuals. Lastly, the tools are always being evaluated and refined through a continuous improvement process. The first tool is the Financial Vulnerability Assessment, or FVA. The FVA is an in-depth assessment to determine the factors involved in an older adult's financial decisions. It measures 2 main aspects of financial management: intellectual and contextual. The first section, the Financial Decision Tracker, looks at the intellectual factors at play in making a specific financial decision. The remaining 3 sections determine the contextual factors surrounding finances, such as financial, psychological, and relationship strain around finances and financial decisions. Contextual factors can overwhelm the intellectual factors and impair the ability to make decisions. The second tool is the Financial Vulnerability Survey, or FVS. The FVS is a 17-item self-report tool that can be used in those cases where there is no specific financial decision being made by a client. The FVS score indicates the older adult's degree of vulnerability to financial exploitation. It was designed to be extremely easy to use in a wide range of clients. The FVS was created as a self-report tool, but can also be administered to the client. The third tool asks a series of questions to a trusted relative or friend of an older adult to better understand the older adult's recent financial decision-making and vulnerability. There are 2 options here. The first is the Family and Friends Questionnaire, or FFQ, which the family member or friend of the older adult can complete by themselves and thus save time. The alternative is the Family and Friends Interview, or FFI, which is administered by an interviewer. These questions examine both the psychological vulnerability around finances and the decision-making skills of an older adult and are best used in combination with the FVA or FVS. Each tool is scored online at olderadultnestegg.com. Resulting risk scores, appropriate next steps, and additional resources can be downloaded and put into a client chart. The website does not collect any personal identifiable information on your client, but does provide you a unique account and case ID. We created self-paced narrated trainings for the FVA and FFI. Simply create an account on olderadultnestegg.com and then click on the training button to get trained and certified. You care about the mental health and well-being of your clients. These free, easy-to-use tools can help you enhance the care you provide by identifying and supporting clients who are financially vulnerable. Good health is a combination of mental, physical, and financial well-being. Use these tools to add an important component to the quality mental health services you work hard to provide.